I worry, sir, about mandates because I think what we're lacking more than anything, and you and I have talked about this, is trust in our institutions and our highest healthcare leaders. And that is going to be a problem here. Mandating our way out of this pandemic, trying to increase take rates for the vaccine, it's a short-term fix. And so engagement's vital here. I've been actually talking to federal contractors for the government here in D.C. right now. They're going to be mandated, sir, to get the vaccine by January 4th, but you still need to engage. So I encourage all corporate sector employers that are subject to a vaccine mandate in New York City to still engage with their workforce. Internal communications is vital, and they frankly need an assist, Sarah, from the CDC. We need clear communication about what acceptable risk looks like. We need to redefine what fully vaccinated is so we can be clear on 3 doses and what that means for each individual. So we need some help here, but there are opportunities to more effectively message to our workforce so that we can increase take rates.
So on the subject of advising to companies, what would you tell and what are you telling the businesses you advise to do about the Omicron variant? Should they delay plans for return to work?
Psychologically, I think if you already have a corporate workforce that's largely work from home, stay that way until April, May. There's no reason to bring back a corporate workforce until April, May, when psychologically, Sarah, we'll be past cold and flu season. We're still plateauing at 10,000 weekly deaths week over week from COVID. That's not going to pass for the next 4 to 5 months. So there's no reason to disturb a good equilibrium now. If you have a company that's already back in the workforce, back in person, make sure it's a vaccine bubble. Make sure that everybody has 3 doses of the vaccine. So there's an opportunity to lead here with science and with clear communication. But if you don't have to, don't go back until April, May.
To what extent are you saying that, Dr. Gupta, based on the fact that we've got the winter coming or based on this Omicron variant? Because just a few months ago, I think optimism was significantly higher than the tone of your response just there. And Dr. Fauci said recently that, quote, it's almost certainly, end quote, the case that Omicron is less severe than anything we've got out there at the moment.
The reality is that despite the optimism, despite this new variant, we're still very much in the throes of a psychologically devastating winter. 10,000 weekly deaths week over week, largely amongst the unvaccinated, coupled with an uncertain flu season. That coupling of risks makes the next 4 months pretty tricky, which is why I say scientifically, if you're fully vaccinated, and my definition is you're 3 shots in, you're fine. So if you create a vaccine bubble as a workforce, that's perfectly acceptable. I know many companies that have created vaccine bubbles, and they've done just fine in terms of really not having any outbreaks, that feeling of safety. But if you're not going to do that, and you already have a largely work-from-home employee base, there is no reason to bring that back until we're past the worst of it, and that's more psychological than scientific.
So how do we get there? How do we get to under 10,000 deaths a week into an endemic phase of this virus where it does not become the economic headwind that it is, and of course, the scary health one, more importantly?
Sarah, it's time. So cold and flu season, cold, dry air, that's why we're seeing 10,000 weekly deaths week over week. Respiratory viruses like cold, dry air. So it's going to take that 4 to 5 months just to get past it from a seasonality standpoint. Also, by then, either people will have some degree of natural exposure to this virus or they will have decided to get vaccinated. Perhaps the federal mandate for the vaccine will have taken effect. Lots of things potentially can change here. The seasonality is our friend. Come the warmer weather, that's when we're going to have the respite. And Sarah, if I may, it's important for all your viewers to really note here, we have to start thinking pragmatically about what acceptable risk looks like. 3 doses of the vaccine, 2 doses of the vaccine. The purpose of a vaccine against a contagious respiratory virus is to keep you out of the hospital. And that's exactly what we're seeing here. Most of the cases here spread out across the United States. Folks that got it, despite being fully vaccinated, they had mild symptoms or they were asymptomatic. That paradigm is success. So we need to really revisit what the concept of success looks like here. That's going to be key as we define what getting out of this pandemic looks like.
Well, with that in mind, Dr. Gupta, to what extent, what would you say to people that say we're now at a stage almost 2 years in, and where we have these vaccines available, where people can have 3 shots so that they're well protected, as you just outlined, that this is now about personal choice, that we shouldn't have governments or companies dictating what people should or shouldn't do. If you want to have your 3rd shot, go and get it. And the rest is up to you.
I think the problem here has been messaging, though. Fundamentally, people don't understand. I cannot tell you how many times I've gotten the question, do the vaccines work? Because we need an additional booster. Why are people testing positive? We focus so much on this concept of vaccine breakthrough illness, we haven't given proper context here about what people should expect, what they shouldn't expect. We need to give clear anticipatory guidance, and that's going to help increase take rates. But I agree with you. I like the longer-term strategy of building trust through clear communication, not mandating our way out of this, because that's not going to be a good long-term solution when we face the next health threat.
And it's interesting you put that trust on the employers and corporations to build that within their employees. Dr. Gupta, thank you for joining us. It's good to have you.
Thanks for having me.